Hello, you are welcome. So today we are discussing neonatal jaundice. Okay, so we'll start by defining who a neonate is. So saying neonate refers to a newborn baby from birth up to 28 days. That's a neonate. Then we have jaundice. So jaundice, we are saying, this is also known as icterus. Saying it's a yellowish discoloration of the skin and the sclera due to high bilirubin levels. Okay, so now trying to combine neonatal jaundice. So neonatal jaundice is saying this is a condition in a neonate in which there is yellowish discoloration of the skin and the mucous membrane due to excess bilirubin in blood. Okay, now the types of jaundice. I've only picked two. So there is a physiologic jaundice. So physiological jaundice, this is the one which is the most common. Physiological jaundice is mild and self-limiting. It is not associated with a pathological condition. So this jaundice, physiological jaundice, it never appears before 24 hours of life, but usually on the third day and fourth day and disappears on the seventh day. Okay. So what may lead to physiological jaundice? Okay. So there will be excess destruction of red blood cells. Okay. Sometimes it could be due to liver insufficiency. The liver is not yet matured. Okay. Again, there could be inadequate reabsorption of bilirubin from the gut, from the gut. So peristalsis is slow until feeding is done. Okay, so that's what happens. The peristalsis is usually slow until feeding is done. Okay, so the gut is not yet colonized by normal floras which convert bilirubin to stachybilinogen and urobilinogen. Okay, then we have the pathological jaundice. So pathological jaundice, this is as a result of a disease or abnormality in the body. Okay, so here are some of the causes of pathological jaundice. Okay, so there could be rhesus factor incompatibility. So maybe the patient is rhesus factor positive, the mother is rhesus factor negative, or the mother is rhesus factor negative, the patient is rhesus factor positive. Then there's also ABO incompatibility. Then there can also be infection. There can also be sickle cell disease. And there can also be obstruction of the biliary tract. So these can be some of the causes of physiological jaundice. Okay, so what are the signs and symptoms that one can experience, that one can observe? Okay, so there can be yellow discoloration of the skin and the sclera. The urine can be dark, amber, and concentrated. The child can be lethargic, can also be poor feeding and irritability. Okay, so there can be many more signs and symptoms. Okay, so now let's come to the understanding of bilirubin breakdown. Okay, so when the lifespan of red blood cells is done, okay, so hemoglobin is broken down. Okay, so it's broken down into two portions. Okay, it's broken to heme and uh, globin. Okay, so the globin will be uh, will be made into proteins, the amino acids that will be used by the body. So globin is not associated with the pathogenesis of a jaundice. Okay, then the heme portion is the one that now that it will undergo oxidation with the help of oxygenase. So it will become biliverdin. So biliverdin, this is a green uh, pigment that is produced. Then from biliverdin, there will be reduction that will take place. Okay, so that there is a yellow pigment that usually develops, and this pigment is called bilirubin. So this bilirubin is usually unconjugated bilirubin. Okay, so this unconjugated bilirubin is taken to the liver through the blood vessels. Okay, so that's where there is conjugation of bilirubin. So when it has become conjugated now, it means it is water soluble. So the conjugated bilirubin is taken to it moves to the intestines. Okay, so that's where it moves, in which uh, it is converted to urobilinogen. Okay, so now the urobilinogen is excreted in feces as stacobilin. Okay, so that's the one that is excreted in feces. But some will be reabsorbed. Some of the urobilinogen will be reabsorbed and taken to the liver. From the liver, it will go to the kidneys. Okay, so from the kidneys, it will be excreted in urine as urobilinogen. So, in short, that's the understanding of bilirubin breakdown. Okay, so what's the treatment? So we are saying phototherapy. Phototherapy is one of the treatment that can be done. So this will help break down the unconjugated bilirubin. Then there is also exchange blood transfusion. This one is rare. Okay, but this one will help remove the blood which has excess bilirubin and transfuse the blood which has low bilirubin. Then you can also initiate early breastfeeding and frequent breastfeeding. So this one will help to improve peristalsis, and the bilirubin will be excreted as a stacobilin. Okay, so what are the nursing what are the nursing diagnoses that can be made? Remember, as you are nursing the patient, you need to take care of the patient under phototherapy. Okay, you do some nursing care under phototherapy, you observe for dehydration, you also uh, observe, tend the patient so that all the parts of the body are exposed, and to prevent the patient being overheated in one area. Then also you need to um, do the care on blood transfusion, checking the donor type, uh, the blood group of the donor, the blood group of the patient, and also checking vital signs during blood transfusion. So here are some of the nursing diagnoses that can be formulated to the patient with a neonatal jaundice. Number one, we are saying ineffective breastfeeding related to respiratory distress evidenced by poor sucking. Okay. Number two, you are saying risk of injury related to phototherapy. Okay. The other one is saying risk of injury related to exchange transfusion. Then again, we're saying risk of injury related to immature immune defense. Okay, so these are just some of the nursing diagnoses. But there's something that you need to take note of. This channel is not a substitute for school and the hospital. Thank you very much. Until next time. Bye bye.